Hello, everybody. Thank you all so much for coming out here today. We are the Doctors Against Genocide Denver local chapter. We wanted to organize a press statement today in conjunction with the national movement regarding the current events happening in the Middle East and Gaza specifically. We have Dr. Omar Mubarak, a local vascular surgeon, who will be giving the statement, but our group is composed of physicians and healthcare workers from across all the different fields, specialties, and hospitals within the state of Colorado. Without further ado, I pass it off to Dr. Omar Mubarak.
Thank you very much. For those of you who don't know me, my name is Omar Mubarak. I'm the managing partner at Vascular Institute of the Rockies, and I'm the past president of the Colorado Medical Society. A lot of my friends, when I decided to run for president of the Colorado Medical Society, asked me why I was doing it. They said to me that, Omar, you know, you're 50, maybe you want to work on getting your kids into the colleges of their choice and then slowly work on your retirement or phase yourself out rather than taking on a new job. But at the time, I told a lot of them that the reason why I wanted to be president of the Colorado Medical Society was that I was upset with the way in which healthcare was being essentially like bought in the state of Colorado, and I wanted to advocate for my patients and for other physicians. What I learned as somebody who was then working heavily here at the Capitol for advocacy for doctors and patients is that advocacy doesn't just entail what we do here within our city or what we do within our state, but across the globe. We're frequently told as doctors that we need to just take care of the patient and not get political. And I think everybody here has heard that at least one time in their life. But the fact of the matter is it is healthcare workers, doctors, nurses, PAs, that should be the ones who are advocating, because it is us who see the devastating effects of policies, and we're the ones who end up taking care of those policies that have gone awry. So it is a great honor for me to be standing here with members of Doctors Against Genocide to advocate once again for a completely disenfranchised group, the people of Gaza and the people of Lebanon. So I will, without further ado, I'll read our statement. As healthcare workers and leaders committed to protecting life and health, we must address the immediate and catastrophic needs of Gaza, where nearly every hospital has been destroyed, healthcare facilities have been reduced to rubble, and access to essential services is severely limited. Medical missions have been blocked, and critical resources such as food, fuel, and medical supplies have been cut off, creating an untenable situation for patients and healthcare providers alike. We as healthcare leaders demand immediate action. And here are our demands. Number one, we want an end to the bombing of hospitals and attacks on healthcare personnel. We call for an immediate halt to all bombings of hospital, healthcare facilities, and attacks on aid workers. Healthcare providers and medical facilities must be protected under international law. Number two, we call for a safeguard for children from harm. No child should endure the horrors of war. We demand protection for children in Gaza and Lebanon, ensuring their right to life, safety, and peace. Number three, we call for the implementation of an immediate ceasefire and cessation of violence. A ceasefire is urgently needed to allow healthcare operations to resume, stabilize healthcare services, and prevent further loss of life. And I find it outrageous that we have been calling for an immediate ceasefire for a year just so that we can address humanitarian needs, and nothing has been done. Number four, we call for the cease of arms supply to Israel. We urge an embargo on weapons to Israel, as the militarization of healthcare spaces has led to tragic civilian casualties and destruction of critical healthcare services. Number five, we call for humanitarian access to Gaza. Immediate access for humanitarian and medical aid is essential to deliver life-saving supplies and services, including antibiotics, trauma care, and surgical tools. Number 6, we call for an expanded trauma-informed healthcare training to occur. Healthcare institutions must equip staff to provide trauma-informed care for patients affected by the consequences of war crimes, crimes against humanity, and systemic oppression. This is our call to action for healthcare leadership. We urge healthcare leaders to advocate for legislative action to prevent further violence and support initiatives that protect the well-being of children and healthcare workers. Supporting organizations in Gaza and Lebanon will strengthen their capacity to provide essential medical services, rebuild infrastructure, and sustain healthcare education for future providers. This appeal aligns with the principles of international humanitarian law, U.S. federal law, and medical ethics. The collective response of healthcare leaders and organizations can save lives and support those working under the harshest conditions to provide care. The time to act is now. Join us in this critical mission to defend the principles of healthcare, protect vulnerable populations, and preserve the right to medical care and humanitarian support in Gaza. I also want to say one other thing, and this goes beyond the statement that I was asked to read. I am shocked that healthcare providers are terrified to be fired or pushed out of even a state or work for simply talking about saving children and getting medical aid to people. I'm also extremely shocked at our media. I find it ironic that some people are rewarded for reporting the news, but they're not really reporting the news. They're not looking at the horrors that are going on right now and really telling the truth. And I call upon them to be braver. Thank you.
Our next speaker will be Rob Prince. The statement was also signed by Jewish Voice for Peace Health, and Rob Prince is a local member of Jewish Voice for Peace.
Hi. Just a couple of points, and then I want to introduce two friends. First, I am with Jewish Voice for Peace and also with the Center for Freedom and Justice, Colorado, which is basically an informal sister city program with Beit Umar, a town in the West Bank. Okay, we're here to support the same demands as that Dr. Mubarak has just raised, and also to draw your attention to a bill that is before Congress right now, the House of Representatives, and it's a bill to restore UNRWA funding, the United Nations organization that has been really key to helping Palestinians with their health and other needs. With that in mind, I'd like to introduce Alex Boudroukas, who is a professor of Middle East Studies at the Metro State University, where once upon a time I taught. Okay, here you go.
Hello, my name is Alex Boudroukas. I'm not a medical doctor, I'm a historian, and I need to note that these are my views and not those of my employer. I teach the history of the modern Middle East. UNRWA has provided essential, life-sustaining aid to Palestinian refugees since 1950. This has included employment, food, medical care, housing, and education. UNRWA camps are also significant because they were and are where Palestinians in exile have preserved their peoplehood. By living together, even away from their homeland, Palestinians have been able to maintain their culture and their identity. The history of UNRWA makes clear that efforts to undermine its mission represent a total disregard for Palestinian life. Banning or defunding this organization based on false or misleadingly exaggerated evidence, as is happening now, can only be understood as a deliberate effort to destroy Palestinians as a people through systemic deprivation. It demonstrates the United States will no longer support even the most basic efforts to maintain Palestinian life, and instead subject Palestinians to literal extermination by means of starvation, dehydration, and deprivation of medical care. Article 2 of the Convention on the Prevention and Punishment of the Crime of Genocide defines genocide as, quote, acts committed with an intent to destroy, in whole or in part, a national, ethical, racial, or religious group. By this definition, defunding the agency that has kept Palestinians alive for decades can only be seen as direct U.S. complicity in genocide. It is a clear and deliberate effort to destroy the Palestinians as a national group.
Thank you, Alex. Next, I'd like to introduce Diane Deschanel, who is a member of the Center for Freedom and Justice Colorado and a retired nurse.
I'll speak to the bill that's before Congress right now, and also talk a little more about UNRWA. All right. UNRWA was formed in 1949 to provide assistance and protection for Palestinians after they were driven from their homes and lands during Israel's war to establish itself as a state in the Middle East. In Gaza, there are 13,000 staff, most of them Palestinian. They know their communities and they know the needs of their communities. UNRWA provides many services for the people in Gaza. I won't go into detail because somebody has already covered that. But there are 1.7 million registered Palestinian refugees who are among the residents of Gaza. So the United States has halted funding for UNRWA. There were 15 other countries who halted funding, but they have all restored their funding. In fact, some of them have increased their funding to UNRWA. There's a bill, it's HR 9649, to restore funding, and it's been introduced in Congress by Representatives Andre Carson, Jan Schakowsky, and Pramila Jayapal. There are 70 co-sponsors, including Diana DeGette. She's the only one in Colorado who is co-sponsoring this bill, and I'm proud to be one of her. She is my representative. In Gaza, the fabric of society has been destroyed. Looking to the future, UNRWA will be indispensable in the rebuilding. The many children remaining are wounded emotionally and physically, and their healthcare needs will be enormous. When I worked as a public health nurse, I worked in the school system, and I know that reopening schools can bring a sense of security and hope for the children who have not been in school for over a year now and have endured unimaginable loss. We, the Colorado Center for Peace and Justice in Palestine, call on this state's congressional delegation, both Republicans and Democrats, to support the work for the passage of HR 9649 to restore UNRWA funding. It's a vital measure to tackle the humanitarian crisis in Gaza now and in the future. Thank you.
Thank you very much.
One or two words here. The people here are really a part, the seed of a movement that's not only growing worldwide, but will grow here as well. And I think of, in the past, the movements that mobilized the conscience of this country. And the big one was the movement against apartheid in South Africa in the 1970s and 80s, which won. This is the modern version of that. Actually, in many ways, it's even worse because what we're dealing with here is a genocide. And we have to do whatever we can to stop that, obviously. So this movement is going to take off. Why? Because it's ethical, it's moral, it's anti-racist to its very core, and we're very proud, whoever we are, to be a part of it. Thank you.
Thank you all.